Hello wonderful students. So in this video we are going to cover all the dermatology MCQs from UPSC 2023 examination. Myself Dr. Maddineni Srinivas, your dermatology faculty from Bharat. Already 2024 questions were discussed. The links are in the description, also in the comment section. So these are all the topics which are going to be covered in this video. We are going to start the discussion with the infective endocarditis modified Duke's criteria for infective endocarditis, which one is not a major criterion. So please remember option A, B and D. All of these are under the major. Rod spots is kept under minor criteria. So you can see this is the table from the Harrison. So you are able to see the positive blood culture, the new partial descent of prosthetic valve, new valvular regurgitation, and yeah, blood cultures as I have already seen. So these are all the major criteria, whereas this list is showing the minor criteria. You can see vascular phenomenon under this Janeway's lesions and immunologic phenomenon under this Osler's rod spots and also glomerulonephritis. These are there. So now you might be wondering, what is this Janeway's lesion? So Janeway's lesions are going to be the erythematous or hemorrhagic lesions of the palms and soles, which are absolutely painless. So you can see in this picture, these are the Janeway's lesions. So then what are these Osler's nodes? They are the tender. They are going to be the painful erythematous papules and nodules which are present over the finger. So here you can say this is a Osler's node which is going to be painful. So rod spots, these are going to be seen over the retina and these are minor criteria. Okay, next is this question. So you need to identify which of these is a vascular phenomenon in the Duke's criteria. So I hope all of you do remember now. It is Janeway's lesion, which are the vascular phenomenon. The rest of the options, they are all immunologic phenomenon. They are all immunologic phenomenon. Next is this question on strongyloidiasis. Please remember strongyloides stercoralis. It parasitizes the upper small intestine and absolutely correct statement duodenum jejunum, and it is going to present with fast moving transient rash which can be seen over the body. Absolutely correct statement. Ivermectin is a drug of choice for this condition. So C is wrong. Systemic strongyloidosis is seen in immunosuppressed individuals. Option D is also wrong. That is the fourth statement is also wrong. So answer is going to be A, 1 and 2 are correct. So yeah, this is the larva current Strongyloides stercoralis. In fact, it is called as a racing larva because it is going to be like Usain Bolt, very fast, like a current. It is going to produce the lesions over the entire body. The speed is also important because the next question, the speed of the larva cutaneous larva migrans was also asked. So it is 5 to 15 centimeters per hour, very fast. And yes, ivermectin is a drug of choice. Okay, right. So this is the next question. Cutaneous larva migrans. You need to identify what is the correct statement. Okay. So it is one of the commonest linear lesions seen in the travelers. Absolutely correct statement this is. And it may be associated with recent visit to the beach. Absolutely correct statement, because cutaneous larva migrans, in this the parasite is going to get transmitted through the animal feces, which can be present over the beach. Where there is more likelihood of barefoot walking, because of which this larva can gain entry into the skin. Track moves across the skin at a rate of 2 to centimeters, 1 to 2 centimeters, 2 to 3 centimeters. Okay, fine. That is also can be considered correct statement. And this condition is going to produce very itchy lesions. So non-pruritic is absolutely wrong statement. So the answer is going to be option C, 1, 2 and 4. So again, the same picture. Okay, so here you can see cutaneous larva migrans. Remember, it is due to the filarial larva of the animal hookworm, Ankylostoma brasiliensis, Ankylostoma caninum, but not due to Ankylostoma duodenale. Not Ankylostoma duodenale. This was also question previously. So you need to remember this. And yes, the speed is going to be 1 to 2 or 2 to 3 you can mention. So this is again the treatment for this condition. So here is how the picture of this cutaneous larva migrans look like. Okay, serpiginous lesions will be seen over the body. And this is the next question. You need to identify the necrotizing fasciitis, especially type 2. is caused by? Answer here is going to be group A streptococcus. So you need to know how does this necrotizing fasciitis present. It is a fatal condition, so the patients are going to present with erythematous gangrenous skin, blisters and bullae can also be present. And there are 4 types of this necrotizing fasciitis which you must remember. So type 1 is associated with polymicrobial involvement, where there can be gram-negative bacteria and anaerobes, usually seen in the post-operative surgery and also in the diabetes. Type 2 is associated with streptococcus. So here you can also see the patient having association with toxic shock syndrome also. Type 3 is associated with marine related organisms. So Vibrio vulnificus is important for you to remember. And type 4, it is 4 alphabet F. So F for 4 and F for fungal. So it is fungal associated with mucor or candida, and it is usually seen in immunocompromised individuals. Okay, and this is the next question. You need to identify the correct treatment. So pregnant lady has been exposed to patient of chicken pox. So what is the correct thing about this? What do you want to treat with? So please remember the VZIG, varicella zoster immunoglobulin. Yes, it can be given. Okay. So the next option is the varicella zoster vaccine. This cannot be given. This is a live attenuated vaccine. So we have to not use this. This is contraindicated in a pregnant woman. And also prednisolone, it is a steroid. It has no role in the prophylaxis or in the treatment of the viral infection. So we are not going to use that. So we can rule out 2 and 4 should not be there. So 2 here, and 4 here. So we are left out with the option C, which is going to be marked correct here. But remember, acyclovir is not having any role in the prophylaxis. It is usually used in the patient if they are having the clinical manifestations. But in this case, because there is no option which says only one is correct, so we can select 1 and 3 as a correct statement. So see, please here, acyclovir, it is a antiviral and it can be considered who develop symptoms, which is not mentioned in this question. Okay, right? And those who, if they are having increased risk of complications also, we can give this. Okay, next question. So you can see here, it is a dermal inoculation of the fungal agent due to a thorn prick. So here, if you see the options, all of them are fungal infections, and except for the aspergillosis, the rest of the others, all of them can be inoculated into the skin, producing the skin lesions. And especially thorn can be agent which can cause the inoculation. But if you have to select one of them, so you can better choose sporotrichosis, because this condition, it is also called as rose gardener's disease. It is also called as rose gardener's disease, and it is produced by the Sporotrichia, which is a dimorphic fungus which will produce the linear lesions, as you are able to see in this particular picture. Because this fungi, it is going to go from the distal ends to the proximal end through the lymphatics. Okay, so like I have told you, rest of the others like mycetoma, which will present with granules, sinuses, and also tumefaction, that is a tumor like swelling wherever there is inoculation. This can also be transmitted through the thorn, but this is a rare way of transmission. And also the mucormycosis can also get transmitted through the direct inoculation through the thorns, but this is also rare. So that is the reason why we are going to search sporotrichosis here. Okay, next is this question. Carotenoderma, due to the ingestion of excessive carotene content fruits and vegetables, okay, can be distinguished from jaundice by sparing of which of the following? Please remember, if a patient is having the icterus, then there is going to be scleral involvement, whereas in carotenoderma we are not going to see the scleral involvement. So option D, sclera, is going to be the correct answer. So here you can see the carotenoderma patient who is having this yellowish orange color of the palms. And here you can see a patient of the icterus, due that is a jaundice, where there is scleral yellowing clearly visible. This is the next question on alpha 1 antitrypsin deficiency. So please remember, prolonged jaundice in neonatal period can be seen in this condition. Pulmonary emphysema can be seen in adulthood. Paniculitis is also seen rarely. What is paniculitis? This is the reason why I kept this question. Paniculitis is the inflammation of the subcutaneous tissues or the hypodermis, and that is also possible in this condition. And remember, this is not autosomal dominant disorder. It is in fact autosomal codominant disorder. So 1, 2 and 3, option A is going to be the correct answer in this particular question. Okay, right. Next, we are going to move on and see the salmon patch. So you need to identify what are the correct statements related to salmon patch. Yes, so it is the nape of the neck, which is the usual site for the salmon patch, which is also called as nevus simplex. Yes, okay, so option 2 is right. It is common in children, absolutely correct statement. It needs surgical excision, absolutely wrong. So 4 should not be there in the answer. So we are left out with 1, 2 and 3. 2 and 3 are correct, but please remember salmon patch, it is not a hemangioma, but in the old books it was mentioned as hemangioma. So we can take this as the correct answer. Okay, as you can see here, it is already mentioned in the modern classification. This salmon patch or nevus simplex is categorized as capillary malformation, but not a hemangioma. Capillary malformation is different and hemangioma is different. Both of them are different, but because in the older literature, it was mentioned in the old literature as hemangioma, we can consider this as the answer here. So this you can see the beautiful child, nevus simplex, and also the pictures of the port Weinstein. Please remember these two pictures A and B. These are the salmon patch where you are able to see over the nape of the neck and also over the face. You can see that it can be bilateral involvement. Whereas here this C is giving a picture of the port Weinstein, and this is going to be present on the unilateral side, and it is going to persist for lifetime if it is not treated. This is permanent condition, port Weinstein. And what is the treatment? We can use PDL. PDL, which is pulsed dye laser. Pulsed dye laser can be used in the treatment for this condition. Next is Klippel-Trenaunay syndrome. So yes, it is a cutaneous nevus which the patient can present. Absolutely correct. Varicose veins can be present, and soft tissue and also bone hypertrophy can also be seen in this condition. So 1, 3 and 4, option C is the right statement. Subcutaneous lipomas are not associated with the Klippel-Trenaunay syndrome. So this is the triad which we can see in this condition. Capillary malformation, port Weinstein, cutaneous nevus can be seen. Varicose veins, venous malformations can also occur. Hypertrophy of soft tissue and bone can also occur. So here you can see these are the pictures of the Klippel-Trenaunay syndrome where you are able to see the capillary stain here. And also there is this B which is showing the enlargement of the lower extremities. So hypertrophy of the soft tissue and also the bone can occur. Next is trichobezoar. Trichobezoar. So it is a hairball in the stomach. Correct statement. Okay, so it is commonly seen in the psychiatric patient. This is also absolutely correct. Usually they are associated with the obsessive compulsive disorder, and they are going to pluck their hairs, and it is going to be called as trichotillomania. And after plucking, they are going to eat it, because of which there is going to be a ball of the hairs present in the intestines. Okay. And what is the other statement? Common complications are bleeding, perforation, or obstruction possible because of this ball of the hair. Treated with long course of proton pump inhibitors, that is not going to be sufficient in this condition. So option A, 1, 2 and 3 are the correct statement. So this is the trichobezoar which you are able to see, very gross okay, ball of the hair. Right. And yeah, so which one was that? Yeah, complications of bleeding, perforation and obstruction can also occur in these patients. And what is the treatment? Usually it is going to be performed. Treatment is going to be with endoscopic removal if it is present in the small bezoars in the upper gastrointestinal tract. Surgical extraction if they are very, very large, as you are able to see here. This is very large bezoar, trichobezoar. Yes, this is the next question. So this is basically a gynec question. So here the answer is going to be genital tuberculosis. So I'm not going to the details of this gynec part, but genital herpes. How is genital herpes going to manifest? It is going to manifest as grouped vesicles which are going to leave behind polycyclic erosions. Polycyclic erosions. And the patients, they are going to present with painful genital ulcers and also painful inguinal lymph adenopathy. So this is going to the picture. Whereas syphilis, which is due to the Treponema pallidum, we are going to see in these patients the painless characteristics of both genital ulcer and also the inguinal lymphadenopathy. And one more thing about gonorrhea, I just want to tell you, gonorrhea can produce, Neisseria gonorrhea can be associated with pelvic inflammatory disease, in which I hope all of you know the kit number 6, which is yellow colored kit, is going to be utilized. And remember, in gonorrhea, there is going to be a presentation which will be acute in nature, not like this, which is mentioned in this question. So that is the reason why it is ruled out. Okay, next question about NACO, National AIDS Control Organization. So you need to identify which one is the two statements. Screening high risk cases of HIV. Yes, that is the job of NACO. Public education towards a safe sex. That is also right. Health education. Treating HIV cases free of cost. That is also absolutely correct. Antiretroviral therapy will be given. Facilitating adoption of the orphans is not the function of the NACO. So we are going to mark the answer as 1, 3 and 4. Yes, option C. And who are going to take care of the adoption of the orphans and stuff? Ministry of the Women and Child Development, that is going to take care. So I hope this video was helpful. If so, please do hit that like button. Also do share this among your friends. Thank you so much for watching. Complete the watching of the other years UPSC videos also. I will leave the links in the description of the comment section. Thank you so much. Happy learning. Sarvam Sri Krishna Sarve Jana Sukhna Bhavantu. Bye bye. Take care. We'll meet in the next video.